John McCain, George W. Bush, Senator Mitch McConnell, Congressman Exxon Eddie Whitfield, this vid is for you. Enjoy.
Anybody got the health insurance blues? Well, I woke up one morning, I was feeling sick. I called a doctor to see me quick. A voice on the phone said with no hesitation, if you've got insurance, you're our patient. And I said, well, it's just a sore throat. I can pay the bill. She said, well, that'll be $80 to examine your tonsils, plus another $160 to establish you as a patient. So I called around to some companies. I said, I'd like to buy some insurance, please. They said, well, we'll have to examine you first to find out if you're an acceptable risk. Because we have to make sure that you won't actually get sick. You see, health insurance is for, well, healthy people. So they analyzed my blood and my pee. They scrutinized every inch of me, took a medical history of all my relations, back about a dozen generations, and then they said, oh yes, there's just one more thing. Do you have any pre-existing conditions? Just one, I said. It's called life. So they signed me up and told me the terms for helping my body to fend off germs with a co-payment here, a deductible there, and a sky-high premium for each month's care. And they said, now if you have to go to the hospital, don't worry, we'll be right there, looking over your doctor's shoulder. I was starting to see where the problem lay and why I was having to pay and pay. I said, this isn't really about my health. It has something to do with increasing your wealth. And they said, now, just what country do you think you're living in, son? Sweden? Japan? England? Spain? Germany? New Zealand? Canada? Iceland? China, France, Australia, Chile, the Netherlands, Portugal, Cuba, Norway, Hungary, Denmark. Well, you get the idea. It could be just about any industrialized country in the world except for the United States or South Africa. Oh, wait a minute, I forgot. South Africa's got health care now. Yes, health care ought to be guaranteed. It's about our lives, not some middleman's greed. And if we all get together and we organize, we could have a new system. Get rid of those guys. Yep, we'll have universal coverage. Health care for people, not for profit. Why, pretty soon, we'll all be feeling so good that we'll think we died and went to Canada.
Thank you, Paul. Thank you, Paul. Great.
Everybody in!
Nobody out!
Everybody in!
Oh, yeah.